We're talking Botox this morning, and women are asking for extra Botox to get longer results to save money. Now, we've got Dr. Eranki on the line this morning. Good morning, Doctor. How are you?
Good morning, Marnie, and good morning, Campo. Thank you for having me on.
Our pleasure. You're the CEO of Cosmetic Australia. Tell us about Botox itself. More and more people are using it with their lips and their cheeks and all sorts of things.
Correct, yeah. It's becoming a very popular treatment. And in fact, in Australia, we spend the highest per capita in the world on cosmetic treatments.
Why? Why do we do that? What's the reason?
Oh, there's many reasons why. I mean, I think we're driven a lot by social media. As a country, we've always been more preoccupied with aesthetics, given that we are out and about all the time, given that the weather's always amazing. And what we are finding is over time, the trends are that people are having the treatments at a younger age and people are having higher doses as well.
Can it go wrong, Botox? You know, plastic surgery obviously can go wrong with your skin and your lips and what have you, but what can Botox do?
Yeah, so all medical treatments carry risk, and this is something that we cover in great detail with our patients during the consultation. So if you look at Botox itself, you can almost assume that 100% of patients will have some kind of bruising after the treatment because it does involve a needle. It does involve the needle going into your face a few times. On top of that, some people get headaches that may last 24, 48 hours, and other people, in more extreme cases, could get a temporary droop. But these droops basically disappear off by themselves within about a week. When you look at filler, there's similar treatment and risk profiles as well. So you could get a bruising almost in 100% of cases, but some patients may get, in worst case scenarios, what's called a vascular occlusion, where it interferes with the blood supply. But the good news is the fillers themselves can be dissolved instantaneously.
Wow, okay.
But if you look at the whole treatment as in terms of their safety profile, it is one of the safest treatments available. And it is the treatment category that has a lot of published research behind it as well, given that it is very popular.
Yeah.
So if it's done properly, it's safe, but yes, it does carry risk.
But we're talking about today people asking for extra Botox to get longer results to save money. Is that bad?
We don't think it's good, and we think there's two reasons why it's happening. Number one is that patients' aesthetic goals are changing, so they are expecting a completely flawless, wrinkle-free, immobile, or a frozen face. That's not possible. And the second thing is, in my opinion, it's also because of the current economic climate. So they're thinking, if I just have a little bit more, it may last me a lot longer. And I think it's the responsibility of the person doing the injecting to educate the patient on how it works.
Yeah.
No matter what the dose is, it lasts 3 months. It will wear off in 3 months. And between the 2 weeks and the 3 months, it starts wearing off gradually. So it's not as though it comes to a sudden halt at the 3 months' time. So we take the approach of titrating the dose of the Botox to the patient's desired end result. Because it is a medication, the key is to give the lowest possible dose in order for the patient to have the best possible outcome.
Right.
So this balances the safety profile with what their aesthetic results are.
But isn't Botox isn't it a neurotoxin that people are injecting into themselves?
That is correct, yes. I mean, the drug itself has been around for many years. It actually started off by an ophthalmologist to help with strabismus of cross-eyed. There's a lot of non-aesthetic treatments that Botox is useful for. So people with cerebral palsy or strokes, for example, have it injected into their muscles to help with contractures. Often urologists use it as well for bladder spasms. So there is a lot of other uses as well. But in the field of aesthetics, what we do is we use much, much smaller doses because we are looking at much finer muscles that just need a little bit of tweaking in order to make the wrinkles less prominent.
Right. And before you go, just on vaping. Now, I've heard that vaping, anything with nicotine in it, can cause the collagen in your skin to break down. Is that correct? Does that have an issue with Botox?
Absolutely. So smoking, which includes cigars, vaping, even marijuana, is really bad for collagen. So if you look at patients who smoke versus patients who don't smoke, you find that the patients who smoke do age a lot quicker. And this isn't the kind of aging that a little bit of Botox or fillers can actually just mask. It's horrible for your body.
Right. Well, Doctor, wonderful to talk to you. Where can people check out some of the things that they need to know about Botox and vaping and these sorts of things?
We don't have anything about vaping on our website, but we have copious amounts of information about Botox on our website.
Right.
So patients can go to our website, which is cosmetique.au, or our Instagram, which is exactly the same, cosmetique.au. And we'd be able to provide all the information that they need. All our consultations are free, so if patients have any questions, they'd be able to book an appointment and have a chat to our nurses.
Yeah, well, it's wonderful to talk to you. Dr. Vivek Eranki, CEO of Cosmetique Australia. Thank you.
Thank you.
Marnie and Campo, River 949.